Seated comfortably in Sukhasana, that's the cross-legged position, or Padmasana, the lotus pose, with spine upright, shoulders tucked back of the head in line with the spine and eyes gently closed. Let us have our energy levels soaring as we try to practice group pranayam. To start first, with awareness on the abdomen, inhaling, inflating the abdomen, and exhaling in kapalbhati. Inhale, inflate the abdomen like a balloon. Hold the inhalation as you push your pelvic platform down. Exhale in kapalbhati. Active exhalation. Continue this. Abdominal inhalations. Kapalbhati exhalations. Remember, when we inhale, we have to inflate the abdomen like a pregnant woman and push the entire pelvic platform down. What's a pelvic platform? The anus, the perineum, which is the vaginal area, and the urethra. Everything has to be pushed gently down on the floor or the bed or your yoga mat. And we hold the inhalation just for a few seconds, few comfortable seconds. And then we exhale in a sudden exhalation, pulling that abdomen in kapalabhati. So we are combining a pranayam of an abdominal inhalation with a shodhan kriya, a cleanser of kapalabhati. Abdominal inhalations help in reverses tendencies of acidity, acid refluxes, constipation, gas, indigestion, excretion of vegetable matter in the feces, in the stool. Kapalabhati exhalations will help tone and activate the visceral organs of the abdomen. Visualize them. Visualize your stomach, your liver, your gallbladder, your diaphragm, the pancreas, the liver, the spleen, the large and small intestines. Abdominal inhalations, kapalbhati exhalations. A pranayam combined with a shodhan kriya. Make sure while doing this combination, you're very comfortably seated in one of your favorite meditative postures. A cross-legged position called Sukhasana, or the lotus pose, Padmasana, or the adamantine pose, Virasana or Vajrasana. There are no contraindications to abdominal breaths or kapalbhati. And here we are blending both. Generally, there are no hidden dangers to these pranayams, only if we don't push ourselves beyond our capacity. Inhale fully, inflate the abdomen like a balloon to permanently say goodbye to constipation. Exhale completely, pull the abdomen in. We've seen miraculous results with kapalbhati, and here we are doing almost 80% of a kapalbhati, not half a kapalbhati. Because kapalbhati mainly consists only of active exhalations. Problems, pressures, stresses of daily life make the entire abdomen, the gut, the jatha. Very uncomfortable. And here with abdominal breaths, we are making our gut, our abdomen, our jatha completely away, cured from the shackles of tensions, of holding back, of retention. And all this within our capacity. We don't push ourselves. Discontinue. And now, without taking a pause, start with normal kapalbhati. Count only 11 kapalbhatis. We want to do only 11. Count them in a descending order, starting from 11. Which means now don't do any abdominal breaths, abdominal inhalations. This has helped us distinguish between what we just did before this, abdominal inhalations with kapalbhati exhalations, from just normal kapalbhati exhalations. We now do 11 abdominal breaths, which means we say goodbye to kapalbhati for now. We inhale and inflate our abdomen like a balloon. We push our full pelvic platform down. The aim is the perineum, the urethra, the pelvis. We retain only for a few moments and we come back, exhaling. 11 rounds. Abdominal breaths. If you finished 11, pause. If you're still on your 11, complete this one. If you're not done with 11, continue with your count till you're done with 11 abdominal breaths. They call it the lower breath in the West. It's all about inflating the abdomen and bringing it back to normal. You feel a sudden freedom in not only the visceral organs of the abdomen, but also in the head. For those of us who finished, without taking another pause, we bring our right hand in Nasagraha Mudra, where the index fingertip and the middle fingertip are rested on the thumb pad at the thumb joint, and the ring finger and the little finger are open. To do alternate nostril kapalbhati, active exhalations alternately from the nostrils, starting with the left nostril. Make sure you pull your abdomen in. You may pause at certain times when you feel you need some rest. Alternate nostril exhalations with resonance, in a rhythm, not overdone, not underdone, which means lifting the capacity, your pace, your speed, your volume, your intensity, your pauses, just the way you want to do it at this point. Active exhalations. Kapalbhati from alternate nostrils, making sure the airways open up. Some of us may have our ears popping open. Some of us may even experience certain impediments and discomforts. Go easy at that time. Again, increase the intensity. You choose. Let no other teacher choose for you. You're your own teacher. Your speed, your intensity. Pauses when you think you need them. Restarting when you think you can restart. Alternate nostril kapalabhati. Clean those nasal airways. Slow down your breath. Remove mucus and phlegm from the nostrils, the throat pit, the larynx, the esophagus. Reverse thyroid. Beautify your voices. Slow down the breath and hence improve and increase your lifespan. Yes, we may face a few situations or notice certain situations. Ears popping open, a closed nostril opening up. Discover that on this journey within. The Kapalbhati is out, but the mental journey is within. And continuing Kapalbhati, just bring the hand down. So you're only pulling your abdomen in with active exhalations. Kapalbhati is not pranayam, it's a cleanser. Kapala is forehead. Bhati means light, illumination. With a pun on the word, experiencing lightness in the kapala, the forehead, the head, experiencing and looking for that candle flame, that illumination at the eyebrow center at the bhumadhya. Notice how you feel at this time while preparing to end the Kapalbhati. And notice how you feel after ending it now. Last 3, 2, 1. Discontinue and watch. Not only the breath, not only the abdomen, not only the throat pit, not only the nasal airways and passages, also the mind, also the pace of the breath. It is called Rog Anusar Yog. A yog, which is a connectivity, a union, a yud. Anusar, according to. Rog, disease. So it's supposed to reverse every disease that everyone has. For those of us who may not have any, that's great. Increases the lifespan. Our breaths are predetermined, not the number of years we live. That is determined by the speed of our breath. Kapalbhati slows it down. Watch the breath now. See the rhythm in it. Watch its resonance. Getting ready for pranayam once again. We start with Bhastrika Pranayam, a vitalizing one, the energizing category. For those of us who can sit comfortably in Vajrasana, we sit in Vajrasana. Vajrasana is by sitting, resting the hips on the heels, that's how Vajrasana is. Resting the hips on the heels. To start with Bhastrika. What happens with Vajrasana? The adamantine pose is we much reduce the circulation in the legs, the blood circulation. Hence, circulation increases in the upper body. And we then bring our hands in a loose fist at shoulder level. Inhaling, we lift our hands up and open the palms. Exhaling, we bring the hands into fists and close the fists. For those of us who are keeping a count, 3 sets of 20. For those of us who need a guided set, here we go. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, and a third set on your own. Just like in Kapalbhati, we can choose the pace, we can choose the intensity, we can choose our volume. We do not want to be uncomfortable when we do our pranayam. We can also take a pause and we can also increase the intensity. All we have to do really is target at filling our lungs with oxygenated air on inhalations in Bhastrika and emptying them completely from deoxygenated air on our exhalations when we do Bhastrika. Oxygenates our nerves, our tissues, our systems, our organs, especially the lungs. Reverses asthma, bronchitis, post-COVID situations where there is tremendous weakness and still a little breathing situation. But of course, we have to do it within our capacity. Bhastrika is best done after Kapalbhati because nasal airways are also clear, nostrils often opened up. On finishing 3 sets, if we are comfortable, we continue sitting in Vajrasana, the adamantine pose, or we can gently drop our hips down to one side and once again come to a seated, comfortable pose in a comfortable environment with comfortable cross ventilation, a well-ventilated room. To start, with a cooling pranayam. It's called Tapo Pranayam in the West, Shitali Pranayam, to cool not only the body, but to start cooling with the abdominal pit, what they call the Jathar. That's the right word for it. To reverse acidity, heat in the abdomen, excessive hair fall, pimple, acne, age-related pigmentation and darkening of the skin, cirrhosis, skin diseases. Fold the tongue like a Frankie, like a taco. Stick it as out as possible and inhale. From the airway, from the passage, from the pipe, between the tongue fold. Fill the lungs with oxygenated air via the tongue, the mouth. Then bring the tongue in, purse the lips, and exhale from the nostrils, a normal exhalation. Continue this. Shitali Pranayam. The lotus pose Padmasana is one of the best ones to do any of the pranayamic practices, but never at the cost of damaging one's knees. It's only if you're in regular practice or can do this effortlessly. Post-operative knee situations, those with RA, that's rheumatic arthritis, etc., will not sit in Padmasana, the lotus pose. Just be comfortable with stretched out legs or any other comfortable meditative seated posture. Inhale to a point of complete fullness. And although this is about cooling the abdominal pit, it's about filling the lungs. Make sure the intercostal muscles are so inflated that they come almost out of the rib cage when we inhale. Then bring the tongue in. Exhale to a point of complete satisfaction, where you feel there is just no more breath left. Pause comfortably, what is called a sehaj, a kevala kumbhaka. Just a natural pause. Inhale fully, exhale completely. Shitali Pranayam, the cooling category, what the West calls Tapo Pranayam. Removes the heat, also post antibiotics, medication, ill effects of those chemicals that may have gone in, which were probably required or not required during those diseases and illnesses. But now we are working on any damage done by them. Last round, Taco Pranayam, Shitali. On finishing that last round, we start with equal breath, Samavritti Pranayam. We're just going to inhale to a count of 5 and exhale to a count of 5. One round. Inhale, 2, 3, 4, 5. Exhale, 2, 3, 4, 5. Now 6, 6. Inhale, 2, 3, 4, 5, 6. Exhale, 2, 3, 4, 5, 6. Now 7, 7. Inhale, 2, 3, 4, 5, 6, 7. Exhale, 2, 3, 4, 5, 6, 7. And finally 8, 8. Inhale, 2, 3, 4, 5, 6, 7, 8. Exhale, 2, 3, 4, 5, 6, 7, 8. And in the same equal breath now, we try to look for our pulse beats on our wrist to continue with the 8:8 ratio. Samavritti Pranayam. Inhale to a count of 8 pulse beats. Exhale to a count of 8 pulse beats. Always expect silence from my end while doing such pranayams to concentrate on the count. See if you can add abdominal breaths here. Continue ratio 8:8 of equal breath, Samavritti Pranayam. And while inhaling, inflate the abdomen like a balloon. While exhaling, bring it back to normal. See if you can blend 2 pranayams, Samavritti and abdomen. Ratio 8:8. We are ready for it. Yes, we are. Make this the last round of equal breath, Samavritti Pranayam of ratio 8:8 with abdominal breaths. And on finishing that last round, take the hands off. Come into a comfortable mudra, preferably chin mudra because it's basic, where the index fingertip and the thumb tip make a ring with its point of contact, with their points of contacts, and the other 3 fingers are open to face the ceiling. Wrists are rested on those folded knees. To do an anus lock, a mool bandh. Just bring the entire anal area in a lock, folding it inwards, upwards. Hold for a few seconds and release. There are totally 3 locks: Moola Bandh, Udyan Bandh, Jalandhar Bandh. And then there is the big lock of all 3. We are ending this session only by touching upon the Moola Bandh, the anus lock. Strengthens the anal muscles. Age-related problems of passing of stool and feces, etc., for which one needs to wear diapers. A lot of situations, even constipation, not much ease of passing stools from the anus, are reversed beautifully by practicing the Moola Bandh regularly. Just 3 to 5 rounds. Hold within capacity. Do only as many rounds as possible. 3 to 5. And then discontinue to ease off completely, to open up the mudras, to do a good round of palming. Rub the palms, tap them on closed eyes, open and close your eyes in darkness, and then slowly open your eyes. Close them again. Bring that gratifying, satisfying feeling. Acknowledge it if it's already there. Asan, because we sat in several asanas. Sukhasan, Padmasan, Vajrasan. Pranayam, because we did several pranayams from Bhastrika to Abdominal Breaths to Shitali. Mudra, because we did the hand chin mudra and the hand nasagraha mudra. Bandha, because we did harness, lock of the anus, Bula Bandh. Asan, Pranayam, Mudra, Bandh. So with a gratifying, satisfying, thankful mind, let us reopen our eyes. Thank you all. Hari Om Tat Sat.